Epilepsy is recurrent unprovoked seizures. That's what epilepsy is. It affects about 1% of the population. So about 1 out of every 100 people has epilepsy. It really depends. It depends on what kind of epilepsy the patient has, the location of the brain that's being affected. Common symptoms are things such as rhythmic twitching in the face or limbs, stiffness, loss or alteration of consciousness. Those are common. The statistics on epilepsy demographics vary depending on where you look and who you ask. But the incidence of epilepsy is thought to be about 1 out of every 100 to 200 people. There definitely can be a genetic contribution to some people with epilepsy. Some forms of epilepsy are genetic, such as nocturnal frontal lobe epilepsy. Absence epilepsy is thought to be genetic. Juvenile myoclonic epilepsy has a genetic contribution. Again, some people have genetic forms of epilepsy, and so that part obviously is uncontrollable. Other things that can increase the risk of epilepsy are things such as their birth circumstances. So for example, if they were born preterm or post-term, if there was an emergency delivery, if they had the nuchal cord around their neck and perhaps some brain injury at birth, that definitely increases the risk of epilepsy. Things like closed head injuries with loss of consciousness definitely increase the risk of epilepsy. History of alcohol or illicit drug abuse such as amphetamines or cocaine. A history of meningitis, either as an adult or child, a history of brain surgery. All of these things definitely increase the risk of a person developing epilepsy. The risk can be separated by many years from the stimulus. So for example, there are patients that suffered a head injury in their youth and they did not develop epilepsy until 30 years later. So that can happen as well. Epilepsy is diagnosed through detailed history, examination, and appropriate ancillary testing such as EEG and brain imaging, whether it be CT or MRI, preferably MRI. The vast majority of the time, treatment of epilepsy is with medications that are designed to prevent seizures, such as Dilantin, Vimpat, Keppra, Topamax, etc. There are other treatments for epilepsy as well, but those are typically for people that are more refractory. Things like vagal nerve stimulators can help to reduce seizure frequency in some patients. Some patients benefit from epilepsy surgery as well. The best thing that you could do for a person that has epilepsy would be to recommend that they see a board-certified neurologist, make sure that their workup has been appropriate, that they're accurately diagnosed, make sure that they're being appropriately treated and monitored. It depends on whether their epilepsy is well controlled. Some people have epilepsy but they haven't had a seizure in 10 years. In patients like that, there are very few restrictions that they need to observe. In patients with poorly controlled epilepsy, there are a lot of potential restrictions that they need to observe. For example, in Nevada, it's illegal to drive unless a patient has gone 3 months or more without a seizure. If I have a patient that's had a seizure in the recent past, I recommend that they observe seizure precautions, which seizure precautions are things that a patient should not do if they could hurt themselves or others if they had a seizure. So for example, they should not bathe by themselves, they should not swim by themselves, they should not work over a hot stove with sharp utensils, anything in which if they had a seizure they could hurt themselves or others.